Then I show everybody the inside of their vaginas. I'll take 2 fingers, put them in, press down, make sure they can see. And as I bring my fingers out, they can see their pelvic relaxation. And the first question I get asked is, how come my doctor didn't tell me that?
I am lucky enough to have Dr. Troy Hailparn with me today. First off, we're at the International Society of Cosmetic Gynecology. And so we've spent a whole weekend learning about all kinds of interesting stuff. What do you find so exciting about this conference when you attend?
Well, there's always new knowledge. I think that, you think you know everything, or you think you have a handle on stuff, and then you hear other doctors talk, they present their cases and their patients and their perspectives, and all of a sudden you go, oh, wow, I could include that into my practice. And so I think this is a place where you're constantly hearing new ideas, and you can decide and pick and choose what you want to incorporate in, but it certainly widens your horizon to what is out there and what is available for women. And all of our goals is to improve the quality of life and the sexual well-being of women.
Yes.
That's really what our goals are.
Women want better sex, right?
And we should all have good sex until we die.
But I think I've learned a lot just in talking with the leaders in this field that you guys have really had to forge ahead on your own to learn it, because there isn't a fellowship,
correct,
or an official training with it. And so
correct.
Tell me about your path in getting into this, because I know it wasn't as simple as just I took a couple years, and it's evolved over time.
I've had a lot of different unique experiences. Having learned from all of the people that I've had, I've gotten the opportunity to travel internationally and speak at different conferences, and to make new friendships internationally, and learn from my colleagues. So coming here, we get reunited every year. And so we get to see our friends from Poland and Brazil and from all over the world that we know, and get to catch up with as well, and share new ideas.
And see what they're doing and how they're progressing it. And then I do want to talk about the book, because I didn't even understand kind of the origination of all of this. But how many would you say, like worldwide?
Worldwide, I can't say. I know in the United States, there's about 500 or 600 doctors practicing cosmetic plastic gynecology. And it's a very small group. And of course, there's been a lot of negative feelings about this, and the stigma about things like labiaplasty. We're really trying to advocate for women to be heard, to have an increased understanding of their issues. I mean, the word cosmetic in this field can be misleading, because it's really cosmetic plastic surgery. I mean, women and young ladies who start having pain with their labia, they're not looking down and going, oh my God, they're feeling uncomfortable.
Okay.
And it happens with development. With puberty, the breasts grow and the labia grow. Pediatricians don't counsel the moms of preteen girls. So the moms don't know how to educate their daughters. And I always tell my patients, when your daughters are going through puberty, you don't have to talk about anything in detail. You just say, when you're developing more tissue up here, you're going to get more skin down there. And if it bothers you, let mommy know. And that's the end of the conversation. But they need to know that can be an open discussion, a dialogue. Mom, if this hurts, what can I do? And so that's where the plastic word comes in, because this is not all about appearance. So I think cosmetic gynecology, that term can be misleading. It should be cosmetic plastic gynecology, because a lot of it is not only to improve appearance, but it's to improve function, how women feel about their bodies, which then affects our psyche. If you feel good physically, it improves your mental well-being.
And I do think that even for patients, plastic might not even relay that, but it's functional and it's aesthetic, gynecology, to me, so that anyone viewing might understand it, because it's surgeons and gynecologists are surgeons, but that have expanded the education and the skills to now include ways that they can improve an appearance if it bothers someone.
Absolutely.
But then also function with it.
So childbirth, for example, right? It changes the inside of the vagina and it changes the doorway. Okay. But when we're doing a vaginoplasty, it's not for appearance. This isn't cosmetic surgery. This is functional surgery. No one's looking inside the vagina to see your suture lines. And when you bring the anatomy back and bring the muscles back together, you're creating normal or more normal anatomy, so it looks better. but it's not being done as cosmetic surgery. It's being done as functional
To tighten
surgery
and
to help increase sensation, to help reduce air, to reduce partner fallout, to help with tampon stay in. This affects not only sexual function, but bladder function and bowel function as well. Constipation and hemorrhoids are related to damage to the back wall. That back wall damage can push tampons down and out. So this is about function.
Okay.
And so that's,
Yeah.
again, where I think it can be misleading when we just call this cosmetic gynecology.
Yeah, no, I agree. And then you have a part of your practice that does some other things too that regenerate.
So
In
yes, I
addition to,
use I use radiofrequency and platelet-rich plasma, or the O shot, we can call it, to help with all kinds of female issues like leakage of urine, the urge, dryness in the vagina, lichen sclerosis. So there's medical issues that can actually be treated with some of the regenerative medicine. And exosomes is now one of the newer things. And we're finding that can be very helpful for reducing inflammation, again, related to lichen. With PRP, vaginal pain, radiofrequency can help with scar tissue and vaginal pain and reduce inflammation and help restore skin integrity. And both PRP and radiofrequency are FDA approved to treat lichen sclerosis and to address the skin. So these are things we can incorporate into any of our OBGYN or GYN practices to help better our services and improve the quality of care.
I love that. And so one of the things that we've talked about today with multiple, experts is even just the FDA approved, terminology, because we've seen it just with hormones, and we can talk about that because, there's a big move to talk more about perimenopause, menopause FDA approval, but FDA approval is almost like a guideline, right? So they approve devices or they approve things, but don't control what you do as a physician or how
Exactly.
you use a device, right? So you can actually still do you can do research or you can apply it and make sure that it's safe or effective. So what does FDA, how would you explain FDA approval to like patients that are listening? Because I think it gets confusing, or it has gotten confusing with just the black box lifting, because now, it's again, the FDA lifted something and now they're confused about like all hormones being safe or not being safe. And so any simple messaging for
So
patients to
I think the
understand
first
that?
message that I would tell women is not to be afraid of estrogen. We have ovaries on our body that makes estrogen, testosterone, and progesterone for 45 to 55 years, and we're not all getting cancer. It doesn't cause cancer. Can it stimulate cancer to grow in somebody who has cancer? Yes. Can it increase the risk for somebody who has a propensity for cancer? I think yes. So we have to be vigilant and having women follow up appropriately. But even with the use of vaginal estrogen in women who've had breast cancer, it's okay. It's very low dose, it's minimally absorbed, and for years they've been fighting it. Now, radiofrequency can also restore lubrication to the vagina. So if women are afraid of hormones and they're in that category, we also have hyaluronic acid, we have the carboxylators. So we have a lot of different options to help women that are not hormonal. But hormones are like water to a plant. When our
Things
hormones
change.
dry up, so do we.
Yeah.
Okay? We
Yeah.
dry up, we shrivel up, and like a plant, we need that estrogen. And so I really believe when the thyroid stops working, we replace the thyroid hormone.
Yes.
Why is it any different when the ovaries stop working than we're not replacing the ovarian hormone? So I think
Yes.
hormones are very important for our function. And I'm very glad they took that label off.
Yes.
Because we don't want to have to try and convince somebody to take something that's already in their body and that's normal for their function.
Yes.
So making sure they have a good understanding, and anybody who's afraid, they have other options.
Yeah.
Soy products have have metabolites of estrogen in them, and they can take the edge off as well. So there's things that we can offer women if they don't want to use hormones.
And I think it does at least make the ones that might have been a little more scared feel safer about it. So you've done a TED Talk on women and women's health.
Yes,
So
I
tell me
have.
a little bit about that.
So it's called Female Anatomy 101, and it goes through the different phases of growth and development from puberty to pregnancy to perimenopause, how our bodies change, and it gives information that not all of our doctors are giving us. It's pure education on the fact the labia grow and the issues that can be created by having larger labia that nobody asks about. When an OB puts in a speculum, they never ask, does this tissue bother you or get in the way? And I really think that every OB, every GYN that's doing a pap smear has an opportunity to speak to women about their vulva. The vulva seems to be left out of our education. Everybody's interested in the vagina, but really we have issues of the outer labia, the inner labia, extra clitoral hood skin that can impede, that could cause access issues, hygiene issues, and sometimes even appearance if you've got pigmentation. So, we need to make sure that we're understanding what the issues are the women are coming in with and not be afraid of the outer structures.
Yes.
And the
yeah.
problem also is insurance-based practices don't give doctors the time to have discussions. So they come, they get their pap smear, their breast exam, here's your script for hormones, and that's the end of the visit. And there's really no time to talk about their leakage or their pain with intercourse or their labia bothering them. It's another visit, another copay. And so one of the reasons I separated from that kind of medicine, insurance-based practice, is because I wanted to have the time to educate. I'm an educator, and I will sit, I go over anatomy, I go over a pelvic model, I give questionnaires before they come in to help me assess how they feel about their bodies, their sexual function, if they have a distress. And I also ask questions about how everything's working: bladder, bowel, sexual function, and labia. So I know before they come in that these are the areas I need to focus on during the visit. I go over lots of before and after pictures of a variety of anatomy so they can understand. And then we go and we do an exam and I give a mirror. And I make sure not only to show them the external structures, and most women have never seen their frenulum before. That little area that has the clitoral nerve roots, and that's a really important structure. Women don't even know it exists. And so it's really
so you're
amazing.
walking them through.
Yeah, so you have to teach them. And then I show everybody the inside of their vaginas. I'll take 2 fingers, put them in, press down, make sure they can see. And as I bring my fingers out, they can see their pelvic relaxation. And the first question I get asked is, how come my doctor didn't tell me that? How come my doctor didn't see that? I don't always know the answer. They're rushed. Maybe they don't want to do surgery. They're insurance-based and it's on the clock. I don't have the answer, except that I believe it's subpar. Women are not getting their questions answered. They're not getting the education they need. And once they have a better understanding of why their bodies are working that way, they're more open to the options for treatment that are available, whether it's surgical or non-surgical.
I think that between deliveries, like vaginal deliveries, that using lasers might actually help. What do you think about that? Because I think that'll probably be a move in the future, because I remember in the ER, at almost every exam I did, there was a little prolapse when you were coming out, like just relaxation of the walls. And we commonly see it as well in our perimenopause, menopause patients. But I kind of predict that doing some vaginal laser treatments in between deliveries and pregnancies might be a move in the future. What do you think about that?
That or radiofrequency, because they do increase the blood flow and tighten up the collagen. And I do think that that will help until they're done having kids.
Yeah.
And then they may say, okay, now it's time to do something more permanent. But it can help with the leakage in between, because after 2 babies, 50% of women get stress urinary incontinence.
Yeah.
And so you want to find ways to combat them until they're done having children. So I absolutely agree, it has a place for sure.
Yeah, and when I say lasers, to me, like,
you include,
because we do radio frequency, but we do radio frequency microneedling as well, and then we do have a laser that is erbium and NDI
So the reason I
1064, but yeah.
differentiate them is because the burn risk is different, the downtime is different,
Yes, yeah.
the discharge is different.
Well, and it's really technically not a laser, but I think sometimes it's for simplicity's
and
sakes.
so,
But
so I don't like them lumped together.
Yes,
That's
yeah.
just a personal
Yeah.
thing. But
yeah, well, and I think no, I agree, but like from a patient standpoint, they never really know, and
but they should.
Well,
I
we
think
don't
it's
do
important.
an ablative. So with the erbium that we do,
Gotcha.
it's the Fotona, so it's actually a
Good.
smooth mode, and it's just
Great.
heating.
Yes.
So just we have no ablative ones. So the
Gotcha.
downtime for me, that's probably why I don't. The downtime for us is if we do radiofrequency microneedling intravaginally
Yes.
with like the Morpheus
Yes.
C, then we're talking about
Yes.
something different.
Yes.
And again, I think women have a lot of questions as they, they have pregnancies, they have deliveries, there's changes that happen, hormonal changes. And again, they have lots of questions with no real good like places to go for those answers. But it sounds like even your TED Talk would be one place, but you've also written some books that might help. So tell me about those.
So I have a very nice little book on my website that's also on Amazon called Beneath Your Pink Perfect, Everything You Ever Wanted to Know About Labiaplasty But Didn't Know to Ask. Because most women, first of all, the women that don't have labial issues don't understand the women who do, because we're not generally educating women about their anatomy and the changes that can happen. So a lot of women, when they hear, oh, you want a labiaplasty, why would you want to do that? Because they don't understand that the tissue's getting in the way every day. These women are living with a body part on the back of their mind that dictates what they can do and what they can't do. So you have a huge impact on spontaneity of living because they can't wear certain clothing. They don't want to go to the gym or go to wear a bathing suit, and they're self-conscious. And even if no one else is looking, they're thinking everybody's looking, and they live with discomfort every day. Some, it can fall out of a thong or a bathing suit or lingerie. You can't feel sexy when you have very large labia. They get in the way with intercourse. Hygiene is an issue, trying to keep clean. And so women who don't have these issues have a very hard time understanding, well, why would you want to change that part of your body? It's working fine for me. Because they don't understand how much the extra tissue can be an issue. And so this book basically talks about body development. It has 30 testimonials from patients, talks about the questions you should ask a doctor that you're looking to take care of you, to make sure you're getting the answers that you need to choose the right person for you, right? Because we all need to know, and women don't know the right questions to ask, and they don't advocate for themselves, and they trust their OBGYNs who may not have any experience doing labiaplasty, and they can end up with botched procedures. And so, you want to make sure you're asking, how many have you done? What kind of complications have you had? How do you deal with those complications? Are you accessible? You want your patients to be able to call you anytime if they have an issue, not your staff, not your answering service. I mean, all my patients have my cell phone number. And they don't abuse it, but the patients who need me can reach out to me anytime and I will respond. I will be there for them.
Well, we're definitely going to get your practice information at the end. Everyone will want to know that too. And we'll get into that. But I think that Beneath Your Pink Perfect is the name of the book. I do think that women are probably hardest on themselves too. And so I don't think that us judging anyone else for anything, and frequently even when patients come in, I always ask them, never, it has to be like what they want to see improved, because if ever they ask me, I'm not going to answer, because again, they're hardest on themselves and I don't want to point out anything that might not be bothering them. But I think that also other women don't know, probably should just not judge, because I think that if a woman is bothered by something, then they should get it improved,
But even doctors are judgmental. When the patients go to their doctors and they ask about tightening, they can't feel their partners, they're told to squeeze their muscles. When your back wall muscles are separated, you can't tighten your muscles, you can't strengthen that canal. There's no connection there. The tube is no longer a unit. So I believe Kegels are a waste of time. If you try them for 3 months and they don't do anything, stop. Otherwise, it's a waste of good energy, because it's not being effective. And once those muscles are restored and the tube is a unit again, then you can do the Kegels, and then they'll work because you have actual muscles that are working together to contract.
I really think that if they really worked, they're going to improve their incontinence. But I would say that 100% of the time, for the patients I'm talking to, it doesn't. And
That's
so,
exactly right. And that's why.
Yeah.
It's hard to get that good contraction when the muscles are attenuated, thinned out,
Yes.
or not connected.
Yeah. What do you think about the EMS to the pelvic floor, some of the chairs that they're talking about? What are your thoughts on that?
So again, I think if your muscles aren't connected, this is what you're going to have them do. It's going to stimulate your muscles. Is it going to strengthen them? I could probably strengthen them. Is it going to be enough for every woman to give them significant improvement? I don't think so. I don't think so, because again, if the muscles aren't connected now. So that's my opinion.
Yeah.
And, so I think that with every woman, you're going to get different results. It all has to do with their collagen, their muscle strength, their weight,
Correct.
what it's been through. So there's a lot of other factors as well.
No, I would agree. I think that like what you're doing and is you're thinking through the different causes of it. And yeah, sometimes it may improve, but sometimes not. And I think that's how you're looking at your practice in general.
And you want to make sure women have appropriate expectations on, will this work for me? I mean, even radiofrequency and PRP is all dependent on how your body responds to these things.
Yeah. No, absolutely. And also whether, again, the cell is healthy to respond, sometimes that hormonal component, because we have a lot of patients that, again, the core practice is hormones, but then we're talking to them about sex, but vice versa. But if they're coming with sexual complaints, we have to talk to them about hormones, just because you need those cells healthy if you can.
Yes.
And again, it's not for everyone, but you're working with every patient individualized. But so there's another book too. So tell me about the other book.
So that one is called My Body is Mine Again. And it's all about vaginal surgery and reclaiming your sexual health and your bladder and bowel function health. And it distinguishes between what surgeries you need and whether insurance will be helpful or not. So I try to answer a lot of the questions women have in that book about, will they need vaginal surgery and what will it improve? So that's what it's, and they're paperback books. They're great. They don't have any graphic pictures in them, and they have all my information. So if women want to reach out and have a conversation and find out what they might need, I'm always open to having discussions. I love to educate.
I love that. I love it. So I think that we talked the first day and we were talking about the fact, like, I personally think there's a huge movement happening for women, but I don't think it's the one that's obvious. Like, I think the perimenopause, menopause is a pretty obvious one, but I think that's been going on for 10 years. Finally, the proactive women have gotten, the system to change, and now they're, slowly getting that changed. I love that part, but I think it's the sex. Like, women don't just want to feel better. They want to have better sex.
That's absolutely right.
And so you are finding like conversations. Again, I just think women have gotten more open about this. I've seen a change in my practice.
Absolutely.
Do you feel the same way?
Yes, and because partly there's more information out on the internet. Everybody is looking for information, and then they read and they come in, and of course not all the information is accurate, so it gives us an opportunity to discuss with them. Absolutely, this is important information, and that's really not as supported, and to help guide them. So I do think it is. There's been a big shift, and more women are looking at their own bodies now, feeling a little more comfortable. And I think it's important. Women need to know their bodies so they can understand when changes happen and when they might need to seek help.
Oh yeah, no, I agree. I think that one thing, when I sat back and looked at it, like, again, the reproductive system versus like just the sex system being more of an outside in, the clitoris is nowhere in the reproductive system.
It's crazy.
And, the
and neither are the labia minora.
No,
they leave the whole vulva out.
But they leave the whole vulva out. And so none of that is discussed. And even like the G-spot complex, and I know there's like big debate on that, but still none of that is talked about really. But I think just the amount of sexual experiences they have versus the amount of pregnancies with a focus on reproduction versus sex. And so I just thought that was eye-opening for me, because they are living it on a daily, weekly, monthly, recurrent basis for decades, their entire life, we hope. And yet they only have a couple children, sometimes none, in fact. But we don't talk about sex enough. So I really think women are getting to the point where they want to break through that
Yes, because
taboo
they
and
want
have
better
it.
sex for themselves. It's
Yes,
not all
they
about the guys anymore.
Yeah.
You know, it is about us.
Yeah. Yeah.
And, you know, women also, I think, habitually put themselves last on their own list. They take care of their partners and their jobs and their children and their homes, and they don't take care of themselves. And eventually they do, but I think it takes women until they're in their 40s to kind of say, you know what, it's my turn.
It's mine.
It's my turn.
Yeah.
And I believe that when women feel the best, then they can do more for everybody else.
Correct.
You know, but we need to take care of ourselves. We definitely don't give ourselves enough me time.
And so if you were to give women one last leading piece of advice on how do they find those solutions when they decide they want better sex and their feeling changes, how would you recommend that they go about doing that? Because I still think sometimes it's just Google, but you know, is there anything in particular, like some advice that you would give to women?
Well, I think I would say to make sure, put yourself first. Okay. And don't stop if you don't get the answer you're looking for. Okay. Because there's lots of doctors. We all practice a little bit differently. You might like one doctor's perspective more than another. You might like somebody's demeanor better than another. And so I think we all have different things to offer. And I do think getting more than one opinion before you commit to a surgery or to a treatment is a good idea. Find out all your options. Make sure you're getting all the information you need to make the right choices for you.
All right. Well, tell us how to find you outside of the books. So again, repeat the books for Amazon.
So I have Beneath Your Pink Perfect, everything you ever want to know about labiaplasty but didn't know to ask.
Okay.
And My Body is Mine Again. And both of them can be downloaded off of my website.
Okay. Awesome.
Okay.
All right.
And then I'm in San Antonio, the Cosmetic Gynecologist Center of San Antonio. My website is cosmeticgyn.net.
Okay.
And I can be reached by email at drhailparn@cosmeticgyn.net.
Okay. Awesome.
And I love to talk to patients, and they're welcome to call the office at 210-615-6646.
And thank you so much
Such
for
a
being
pleasure.
Oh, we do have
Thank you
a
for
hat.
having me.
Did you? I don't. Again, more of a marketing tool. You guys don't have to love it, but
This is for information.
it's a yes.
They're so sweet.
Yes,
Thank you.
absolutely. All right. Well, thank you so much.
My
I love that.
pleasure.